Just when you think all of Canada has gone crazy, British Columbia says, hold my beer. Or wait, I've got something stronger and I'd love to give it to your children. I really can't believe I'm reporting on this. I had to put this out on Twitter as soon as I read the article. We'll get into the article in a minute here, but I put it out on Twitter. You've got to be kidding me. BC plans to give recreational bad stuff to kids without parents' knowledge. This is really a thing. Now, before we get into the article, I have to make some caveats here. When I'm talking about this thing here, I'm going to call it Fenty. When I'm talking about this stuff here, I'm going to call it Sufin. And when we're talking about this stuff here, I'm going to call it Hydro. This, hopefully, I'm not saying bad words, things that the algorithm doesn't like to hear. And hopefully this gets out to as many people as possible, because we want to spread this message, absolutely, because this is an important issue and we should be talking about this. Adam Zivo on the National Post put out, BC plans to give safer supply Fenty to minors. Again, Fenty. I can't say these things. And parents won't have a say. No minimum age listed in protocols for providing youth with taxpayer-funded recreational Fenty. This is... I couldn't even believe what I was reading when I read this, but I had to do a bit of research and I went into some of this stuff, and we're going to talk about this in this video. I'm going to try to get through it as quick as possible. In what constitutes a clear trampling of parental rights, British Columbia recently authorized the provision of a safer supply Fenty to youth across the province, regardless of the parents are informed of or agree to this measure. The provincial government has provided limited access to safer supply Fenty since at least 2020. Now, this is not, we're not talking about, many of you have seen Aaron Gunn's film, Canada is Dying, and the pre-film to that was Vancouver is Dying. He talked about the hydro supply that they're doing. That's the safe supply. This is the safer supply. This is supplying something else entire. This is actually supplying Fenty, and this was a trial run, and now they're going full bore with it. And believe it or not, there's actually no evidence in this to suggest that this will actually work. And we're going to get into this primarily through small scale pilot projects. However, last August, British Columbia Centre on Substance Use, the BCCSU, an influential research organization, published protocols permitting doctors and nurses to prescribe safe Fenty tablets to adults and minors. The organization confirmed to me in an email that it had been contracted by the province to produce these documents to further support clinicians prescribing safer supply across the province. Now, getting into this, they actually do have this study. They put it out, and this is the Fenty tablet maintenance program study. Links will all be in the description down below. Please go check them out for yourself. I read through a majority of this stuff. It's really tough to get through these ones, but again, obviously the article and more stuff in here. But in this, they talk about the eligibility, and they talk about who will be eligible for this. And, the usual suspects, users, this kind of thing, people addicted to, the things, Fenty included. But this is a way of getting them into this program, right? So talking about the eligibility for this. Now, for participants who are youth under the age of 19 years old, to prescriber approval is strongly recommended. In this document, there is nothing anywhere that says anything about parental consent, nothing about getting the authorization of a parent. Even in the section where it talks about informed consent, it mentions nothing about who actually has consent over minors in these situations. And they just completely ignore that, and they talk about two people prescribing it, two prescriber approval. So you just need two people to actually make this prescription. And then coverage, obviously, in this one. Once approved, the approval period lasts for 1 year, at which point coverage must be renewed annually. This to me, I don't know how you would read that, but this tells me that this is not a recovery program. I've never heard of any recovery program that expects people to continually, year after year, renew the program and get in and keep this supply of stuff coming into them, because the whole point would be, in my assumption, to get them off of this stuff. No, this is a prolonged period in which they have annual renewals for it. Now let's get back to the article here. While BC's these ads, while BC's government generally promotes commitment to safer supply, it was oddly silent in this instance, because I became aware of the new protocols only because two concerned addiction physicians contacted me shortly after their publication, as there has been zero media coverage of this development, excluding a report that I authored for the Macdonald-Laurier Institute. And we'll have a look quickly at that report. So this is the report from Adam Zivo, Reckless, British Columbia's Safe Supply Fenty Tablet Program. And it's an interesting read. Most interesting is this part where it says concerning lack of evidence. It's deeply concerning that the BC government has, over the past several years, significantly increased access to safe Fenty and Sufin, despite openly admitting that there is no evidence showing that these interventions provide any benefits and can be implemented safely. In general, there is no real evidence showing that the safe supply programs work. Almost all of the studies that support these programs are flawed, and many of them have low quality evidence that would be unacceptable in most healthcare settings. They give examples. Long story short, this one, but they're basically relying on self-reporting. These people are reporting to themselves, and then the other clinical data that they have is urine samples. And the urine samples, they admit themselves, are not reliable because these users could be lying to them and telling them, because they're, well, let's just put it this way. The street version and the safe version look the same in a lab test. So the users could be completely lying using the street version while simultaneously taking this version that they're being given. So the data is completely skewed. It's not reliable. And this is something that they admit themselves, according to this. BC Safe Supply Fenty Tablet Protocol, I almost said the word, excerpts regarding absence of evidence providing Fenty tablets to reduce harms associated with unregulated bad stuff use is not an evidence-based intervention. To date, there is no evidence available supporting this intervention, safety data, or established best practices for when and how to provide it. Prescribed Fenty tablets have been utilized in three programmatic settings. It's all problematic in BC, in the different locations, with evaluations of this novel intervention underway in these locations. A discussion of the absence of evidence supporting this approach, and discussions of continuing care and harm reduction education. This is ridiculous. They don't have any evidence to base their claims. It is concerning that the BC government and Trudeau Liberals keep insisting to the public that safer supply is evidence-based. It isn't. But then, in the fine print of the related policy documents, quietly admit that no evidence actually exists. This is where we're at with this whole thing. And now they want to turn around and be able to give it to children, and without the knowledge of the parent. And this is where it really, really gets concerning. This is a shame, as the new protocols are full of red flags, including jarring near absent of safeguarding measures when giving Fenty to minors, to say nothing of the obvious ethical issues around underage consent. The only special requirements for underage patients is the use of two prescriber approval system, wherein one prescriber conducts the patient intake interview and the other one reviews the client's chart before signing off. So one doesn't even have to meet the kid. This is terrible. A number of addiction experts have criticized this as deeply inadequate. Dr. Lenora Regenstreff, I'm never going to pronounce that correctly, a Hamilton-based addiction physician, said she found it hard to imagine that two doctors or nurses working in the same clinic would significantly challenge each other's prescribing decisions. That is, so it's not a second opinion from another place. It's a second opinion from their colleague right next to them. This is how crazy this is. And I want to encourage everybody to go over and read this article and tell me if I'm getting this wrong, if I'm going overboard and overreacting to this. But this is just, it really is ridiculous to me that this is the extent that they're trying to go with this, trying to prove something that's not clinically proven at all. And this is just a hunch that they have that this might work, when a lot of people are saying, no, there is evidence to the contrary that this won't work. And not only that, but this will actually add to the street availability of a lot of these substances. In fact, this is what's happened with the hydro gimmick that is clearly laid out in Canada is Dying, Aaron Gunn's film, which yeah, you need to go over and watch. It's available on YouTube. You need to be 18 years to watch that, but you don't have to get consent for some of these things here in British Columbia. While some provinces set a minimum age, typically between 14 and 16-year-old, for when minors can make such decisions, British Columbia has no minimum and relies instead on a fluid idea of capability. Youth in the province are considered capable if they understand what a medical intervention involves, why it's needed, and then why it's needed, and risks and benefits. Okay, so how do we know this? Now, this is really problematic, again, with the whole concept of informed consent. How can you have informed consent when you can't even consent? Children these ages, they can't go to a school trip to the museum without a parent's signature. How is it that they could ever sign off or make these decisions for themselves? But hey, I'm going to leave a link in the description down below. I hope that everybody goes over and reads this article. This is a must-have, a must-read. Share it with as many people as possible. Share this video so more people will be aware of what's going on here. But if it's happening here in British Columbia, this is a test case and it's probably going to come to the rest of Canada. This is concerning.